Okay, we got the left eye. Now let's do the right one.
Oh, look at that.
Perfect. Good job. All right. All done. You didn't feel a thing, right?
Wow,
All right. You can slide carefully under, and we're finished. Good job.
Wow.
Great. Hey, before we go further,
Okay.
look at the clock on the wall.
Okay.
Tell me what time it is.
Oh, wow. Oh, my gosh.
For years, I've dreamed about waking up in the morning, opening my eyes, and just being able to see clearly without having to reach for my glasses. I'm just tired of not being able to see. You know, I look better without these things.
The reason I wanted to get LASIK surgery is I have a 5-year-old daughter and she sleeps in the downstairs of our house. And when she cries in the middle of the night, I'd have to jump up, find my glasses, run downstairs. And now I just jump out of bed and I can see, and it's great.
I play a lot of beach volleyball. With the sand and the sun, contacts and glasses, they just don't work. That's why for me, LASIK makes sense.
It didn't take long for me to realize LASIK was the way to go. It appears to be safe with millions of procedures that have been performed. It's a proven procedure, and the results? Well, I have plenty of friends who love it, so that was a no-brainer for me. What concerned me was the part about cutting the flap. I studied website after website, but still, the idea of a metal blade cutting my eye, it freaked me out. And just when I was ready to stick with my glasses, a friend told me about the blade-free Intralase method.
The Intralase method is a 100% blade-free approach to corneal flap creation, the critical first step in the LASIK procedure. The creation of the corneal flap prepares the eye for the second step of the LASIK procedure, when another laser known as an excimer laser is used on the inner cornea to correct vision. Unlike other procedures, the Intralase method creates the corneal flap by applying tiny, rapid pulses of laser light, not a metal blade. Each pulse of light passes through the top layers of your cornea and forms a microscopic bubble at a specific depth and position within your eye that is determined by the doctor. As the Intralase laser moves back and forth across your eye, a uniform layer of bubbles forms just below the corneal surface. Your doctor creates your corneal flap by gently separating the tissue where the bubbles have formed. The corneal flap is then folded back so the doctor can perform the second step of your corrective treatment.
The Intralase flap heals faster and stronger, and since we can tailor-make the flap for every patient, we can create a flap that allows us to preserve a lot more tissue, so the eye is mechanically stronger.
More patients in clinical studies achieved vision that was 20/20 or better when the LASIK procedure was performed with the Intralase method. And patients report better quality of vision overall, particularly in terms of their ability to see well in low light, such as at dusk or at night.
As a former fighter pilot, I can totally appreciate the need to have excellent, high-quality, high-clarity vision.
At the Naval Medical Center in San Diego, a study was conducted on 199 Navy pilots. The results showed that military personnel treated with the Intralase laser had faster visual recovery and better contrast sensitivity and acuity at all post-operative periods.
Basically, you need good vision for every aspect of flying. You don't just need good vision, you need excellent vision. The better the pilot, generally the better the vision.
Are you ready for Intralase? If you're looking for a 100% blade-free LASIK experience that virtually eliminates almost all the most severe sight-threatening complications, the answer is yes. In order to have this procedure, you have to locate an experienced physician who is certified to perform the Intralase method.
Finding a doctor in my area was amazingly easy. Actually, the best source for locating a doctor who uses the Intralase method is on the Intralase website. I found a lot of good background information to help answer any of my questions, and I have a lot of questions. After all, these are the only eyes I have.
Let's take a look at some common questions you might have about the Intralase method and the LASIK procedure.
The Intralase method was not painful. What I felt was a little bit of pressure at first, and then really nothing. And then it was over. It was just so fast.
What I tell all my patients is that the reason I choose Intralase is because of its safety. It's absolutely the safest method of creating a flap. And it also increases the accuracy of the procedure, so that the chances of getting perfect vision are the highest by using Intralase.
Maybe it takes minutes, but it only felt like a couple seconds. Next thing I know, he was working on the other eye.
The procedure for me was very quick. I was in the operating room, not very long at all. It seemed like it was over in a flash. I mean, really, my nerves were so high, and really by the time I'd settled down, it was over.
It only takes 15 seconds to make the flap, and patients are amazed that it goes by so fast, because they always ask me, is it finished? Are you done?
Having the all laser method was just key for me, because I just would not do it if I had to have a razor blade cut open my eye. There's just no way.
Fantastic. I have freedom now I've never known before. I went in and had the procedure. There was no pain involved, and I could see immediately.
Actually, in terms of not paying for glasses and contacts ever again in my life, far outweighed any costs that I was going to pay for this procedure. I also was offered great financing opportunities with the center that I had my surgery done at.
For me, it was a total no-brainer. I had spent so much money on glasses and contacts and solution over the years, and I was able to use my husband's flexible spending account through work, and those are pre-tax dollars, which made it even more affordable. I just think I got a great price, and I got a great physician along with it.
I decided LASIK with the Intralase method was the only choice for me. I couldn't see choosing the uncertainty of the blade over the precision of the Intralase method.
The Intralase method provides you better vision, additional safety, the highest degree of precision and predictability, individualized flaps, fewer retreatments, and it's patient preferred.
Congratulations. Hey, wait, before we go any further, there's a clock on the wall.
All right.
Tell me what time it is.
Wow. Oh my gosh. I can totally read it. It says 10:03 in 15 seconds.
There you go.
Thank you. Thank you so much.
You're welcome.
Thank you.
Congratulations.
Thank
Are you ready to take the next step to better vision? All laser LASIK using the Intralase method is one of the safest, most trusted procedures available. Check out the facts for yourself. And when you decide you want LASIK that is 100% blade-free, ask your physician for the Intralase method by name.